Come on in.
Hi, my name's Kristen. I'm the PA here at the office. Is it okay if I see you today?
Yeah.
Okay, let me just wash my hands. Can you confirm your name and date of birth?
Yeah, Gerald Ford, December 19th, 1993.
Okay. All right. And Mr. Ford, do you like to go by Mr. Ford or
Jerry works.
Jerry? Okay. So it says here that you're coming in for a runny nose. Can you tell me what's going on?
Yeah, the past 5 days, it's just I've had this runny nose that just won't quit. So I'm hoping you guys can give me some answers.
Okay. Has it just been constant this whole time?
Pretty much just, a constant little bit of leakage, just hit it with a tissue, try and blow it out, but still keeps going, keeps dripping.
Okay, so you're constantly blowing your nose?
Mm-hmm.
Okay. Do you check to see what color it is?
It's usually pretty clear.
Clear?
Mm-hmm.
Okay. Have you ever had this before?
Not that I can recall, no.
Okay. And where were you when you first noticed the runny nose?
I was at home. I just woke up one day and, getting ready for the day. I noticed, I just kept on, wiping my nose away and realized it persisted throughout the day. Hope it would get better at night. Didn't get better at night. Hoped it would get better the next day. Didn't get better the next day.
Okay. Have you been around anyone that's been sick?
I don't think so, no.
Okay. Any trauma to your nose? Any
Damage? No. No damage.
No trauma, okay. Have you traveled anywhere recently?
Just to and from work.
Okay. And is there any pain in the nose?
No pain, just the constant leakage.
Okay. Is it one side or is it both sides?
It alternates. Sometimes it's out of one nostril, sometimes it's out of the other. Sometimes it's a little bit of both.
Okay. Any postnasal drip?
No. It's all out of the front.
Is your sense of smell still normal or has that changed at all?
I haven't noticed any change with the smell.
Okay. Are you allergic to anything?
No.
Seasonal allergies?
I usually deal with seasonal allergies, so that's what I thought this was, but usually I would take, some Benadryl to, kick those seasonal allergies, but the Benadryl hasn't helped. Tried Zysol. Zysol didn't help.
How much Zysol did you take?
One pill. One pill every 24 hours.
And how many times have you taken it?
2 days.
2 days. And you said Benadryl as well?
I tried Benadryl for 3 days, that didn't work, and I'm on Zysol for 2 days, still hasn't worked.
How much Benadryl were you taking?
2 a day.
2 a day? Okay. For 3 days?
Yes.
Okay. Have you changed anything at home, like your detergent, any new foods?
Maybe lit a few different candles. I don't know if that would affect things.
Okay. Anything else you notice with the runny nose? You said it's clear, it's not bloody?
No blood in the mucus. No.
Okay.
None of that, and just the leakage. It's just a constant thing. It's just always having to have a tissue in my hand or a napkin, just making sure it doesn't drip into my mustache or my mouth.
Does anything make it worse?
No.
And we already talked about the medication.
Mm-hmm.
Is there anything else you've tried that's made it better? Any positions, anything?
Not really. Haven't really tried to, think of any new sleeping positions or sitting positions. It just, it seems like anytime I'm sitting or standing, I'm always dabbing my nose.
Any coughing?
No. Coughing is relatively clear. Throat's clear. No throat pains, throat issues. Just the nose.
Any headaches?
Head's clear. Head's fine.
Any fevers?
I feel good.
Okay. Any body aches or chills?
Nope, just normal body temperature, as far as I'm aware.
Okay. And have you seen anybody else for this issue?
Just you so far.
Okay. All right. Anything else you'd like to add?
No, I think I covered everything.
Okay. Let me go over this with you, make sure I didn't miss anything, and then we're going to go on with the interview, okay?
Sure.
So, Mr. Ford, you're coming in today with a runny nose that's been going on for the last 5 days. It's been constantly dripping.
Yeah.
It's a clear mucus. You haven't had this before, really, except for maybe some seasonal allergies.
Yeah, nothing that lasted as long as this.
You have no stick contacts. You've had no trauma to the nose, no recent travel.
Nope.
You deny any other symptoms. Just the biggest thing is the runny nose.
Yep.
You did mention some new candles at home. Otherwise, nothing new has been added. Nothing really makes it worse. You did try to make it better with some medication, Xyzal and Benadryl. Both of those didn't really help.
Yep.
Anything else that you'd like to add?
Not that I can think of.
Okay. So now we're going to go on to your past medical history. So can you tell me, have you ever been diagnosed with anything before?
I mean, I've had strep throat a few times before, but
Strep throat, okay.
that was as a kid, and that got solved by getting rid of my tonsils.
How old were you?
I was about 7 years old.
7 years old. Okay. And did you ever go to the hospital for that?
Yes, I went to the hospital to get, had surgery to remove the tonsils.
Okay. And when were the tonsils removed?
Like I said, when I was 7 years old.
Oh, okay. All right. Are you on any medications?
Besides trying Xyzal right now, no.
Okay. All right. Other than the tonsillectomy, any other surgeries?
Nope.
Any other hospitalizations?
Nope.
We already said no recent trauma, no travel anywhere.
No fights, no travel, nothing. Pretty local.
Okay. Are you up to date on your immunizations?
Yep.
Have you gotten your COVID vaccine?
Both jabs last spring.
Okay. Which vaccine was it?
It was Pfizer.
Okay. And now that we're talking about it, have you been around anybody that's had COVID recently?
Not that they've admitted about, no.
Okay.
I mean, I've been out in public, wearing my mask.
Good. All right. And do you have a primary care doctor?
No, I'm in between primary care people at the moment.
Okay. All right, I think I got everything with that. Now we're going to go on to your family history. First, I want to define what that means. So that means your biological parents, your biological grandparents, any siblings you have, and any children you have, okay?
Okay.
So any significant medical history in your family?
Well, I'm a single man with no kids, so no wife, no kids to worry about. My mom has a high blood pressure. My dad has high cholesterol. My grandfather on my dad's side has had a history of urinary infections. I don't know if that's genetic or not. My grandma on my mom's side passed away a while ago. Grandma on my mom's side, she has dementia, so she's got that going on. And my grandpa on my mom's side died of a heart attack in his 60s.
Okay. And are your parents on any medication currently? Like, is it well controlled?
It is controlled. I know they're taking medications for their respective high blood pressure and cholesterol to keep that in check.
Okay. And you said your dad's dad is still alive?
Still alive, yes.
How old is he?
He's about 94.
Okay. And you said your mom's dad passed away?
Passed away in his 60s.
In his 60s, okay.
From the heart attack.
Perfect.
63, I believe.
Okay. All right. Any family history of mental illness?
Does the dementia count as mental illness on my mom's side?
Yeah, it depends.
Okay, so
any other
besides that, no.
schizophrenia or anything like that?
Mm-mm.
Okay. Any addiction to alcohol or drugs in your family?
Nope.
Okay. All right. I think I got everything we need for that. So now we're going to move on to your social history. So tell me, what do you do for a living?
I'm a teacher. I'm a coach.
Okay.
At the middle school level.
You like doing that?
Yeah, I enjoy it.
Good. And you're not married?
Nope, like I said, single.
Okay. So you live by yourself or you have roommates?
Living by myself right now.
Okay. Any pets?
A dog.
A dog. Have you had the dog for a while?
A few years. 3 years.
All right. Okay. Let's see here. And who do you turn to for support?
My family usually.
Your family?
Yeah, they live in the area, so I can rely on them if I need anything.
Good.
I got friends too, you know, good support system there.
Good. And how's your diet?
Diet's fine. Could be better, could be worse, but I try my best.
Good. Any specific diets you do?
I tried keto for a bit, that didn't work very well. Very tough adjustment.
It's hard.
I
It's tough.
need the carbs.
Yeah. Fiber intake, how's that?
I'm pretty regular.
Good.
Fiber's not an issue.
Good. And your water, are you drinking enough water?
Very hydrated.
Good, good. All right. And do you exercise at all?
Yeah. On a Peloton, I'm on there 3-4 days a week, plus all the activity I get coaching the kids.
Good. Do you like the Peloton? They're expensive.
Yeah, they are expensive. Good investment. Worthy investment.
Yeah, they seem pretty cool.
Mm-hmm.
Cool. All right. And now some of these subjects may be a little bit more sensitive, so I just want to remind you that this is just between you and me. It is confidential.
Mm-hmm.
Okay. So do you use any tobacco products?
Smoke cigars every once in a while.
Cigars? How often?
Once or twice a month.
And how many will you usually smoke?
1 or 2.
Okay. And how long have you been doing that?
Since I was 18, so about 8-9 years.
9 years. Okay. Now I wouldn't be doing my job if I didn't remind you that smoking is, not good for us. It does have a lot of health implications, your lungs, your heart.
Heard that before.
So I have some information I can give you about that if you'd like it. If you'd like to pass, I understand quitting is hard, even if it's social.
I'll pass, but I appreciate the offer.
All right. And you don't smoke any regular cigarettes?
Nah, cigarettes I stay away from.
Okay. Do you drink alcohol?
Oh yeah, social drinker.
Social drinker. What do you drink?
Usually beer. Usually beer when I'm out with some buddies.
How much in a typical glass for you?
I mean, usually maybe, in a sitting, like 2 or 3, 16 ounces each.
Okay. All right. How much in a month do you think you drink, or in a week?
Like how many drinks per week, or how many times I go out drinking per week?
How many drinks per week?
Drinks per week.
You said 2 to 3 per sitting.
Yeah, so.
So how many times do you do that?
Probably 4 to 6 drinks a week.
4 to 6 drinks a week.
Yeah, weekends with sports.
All right. Okay. Do you use any illicit drugs?
Nope. Keep it clean.
No recreational drug use, marijuana, cocaine, anything like that?
No ma'am.
Good. Okay. And again, I just want to remind you it is confidential, so I know these topics are a little sensitive,
Mm-hmm.
but are you sexually active?
I am, yeah.
With how many partners?
Right now, I guess just one.
Okay. Male, female, or both?
Female.
Female. Do you use protection?
Yeah.
What kind of protection?
Condom.
Condoms? Okay.
Mm-hmm.
Is she on birth control?
That's what she tells me. Gotta hope she's right.
Are you trying to have children?
Oh, no.
No?
Mm-hmm.
Okay. And the condoms, do you use them every time?
Try to.
Try to.
Yeah, heat of the moment sometimes.
Okay. All right. Well, I think that concludes our section for now, so I'm going to go get this ready to go and we'll go on to the next step, okay?
Sounds good.
All right.